Hello friends. Pregnancy is a wonderful journey in a woman's life. The entire family is in anticipation, awaiting the arrival of the newborn. Although pregnancy is an uneventful condition, there are some occasions where it can give trouble. There are some medical complications and other disorders arising during pregnancy. Let us see the common problems that arise in pregnancy and solutions to them. The most common problem that a woman encounters in the first early few weeks of pregnancy are nausea and vomiting. Although it can be mild, some patients can develop severe vomiting. In the mildest forms, the nausea typically arises at 6 weeks of pregnancy, and it increases in severity around 8 weeks, and it disappears spontaneously by 12 to 14 weeks of pregnancy. Not much treatment is required except for small doses of antiemetics, that is anti-vomiting tablets, and a good hydration and plenty of liquids. Some women may experience excessive salivation, loss of or altered taste and appetite, and this comes up as a common complaint during the early weeks. In fact, the family members, other members are also distressed by this. They keep complaining that the patient takes very less food and drink, and this causes them distress. But remember, in the first 3 months of pregnancy, the nutritional requirements are very, very less. The embryo grows only up to 6 centimeters in size at the end of 12 weeks of pregnancy. And in fact, the nausea and vomiting are protective in nature, preventing the woman from consuming harmful foods. She may experience some altered tastes and other requirements. For example, she may develop a very odd liking towards mud, paper or rice, raw rice. So these are all common complaints. So how do we deal with the more severe forms of nausea and vomiting? This is known as Hyperemesis gravidarum, where the woman may vomit even for 10 to 12, 15 times during the day. She might not be able to tolerate even liquids or even water, in fact, and she might become severely dehydrated, requires hospitalization, intravenous fluid administration, and IV injections to prevent vomiting and antacids. She might require 3 days in the hospital admission, and we treat her with keeping her on nil oral and slowly starting water and liquids at the end of the second day. The next common complaint that pregnant women complain to us is the heartburn and reflux during pregnancy. Again, this is due to hormonal changes. Because of the relaxing effect of the progesterone hormone, the food that is digested in the stomach is not kept in the stomach, but sometimes it can reflex back up into the food pipe. In that case, the patient experiences a symptom like heartburn or chest burning sensation and also burning in the throat. This is because the semi-digested food contains acid, stomach acid, and it can be quite distressing to the patient. So this can start very early in pregnancy, become worse during the later months of pregnancy, because as the uterus enlarges, it places a pressure on the intestines and the stomach is pushed upwards, and thereby relaxing the stomach muscle. So the treatment for this, though there is no definitive treatment, we can reduce her symptoms. So we ask the patient to take small frequent food. Instead of taking large meals, small frequent food, and also to avoid late night intake of large meals, and also to avoid spicy food. So we also treat the patient by giving antacids and sometimes antiemetics and prokinetic tablets. Another common complaint that the pregnant woman gives to the doctor is the urinary burning sensation. Again, urinary infections are common during pregnancy. This again is because of the hormone action and the mechanical pressure of the uterus sitting on the bladder and the urinary tubes, that is the ureters. There is a back pressure on the entire urinary tract, causing stasis of urine and also easy infections ascending up into the bladder. So these urinary infections are something that can be silent during pregnancy. So we doctors actively check for urine infection during the entire pregnancy and treat and look for the type of germ that is growing in the urine and give antibiotics for that. Another common complaint or another common problem, medical problem that arises during pregnancy is the diabetes or the impaired sugar tolerance during pregnancy. The woman may be perfectly normal before pregnancy. She might not be a diabetic. She has good control over her sugars. But following pregnancy, especially in the 5th month, when the hormones increase so much that the placenta also increases in size, the patient has a problem in controlling the sugars. Her blood sugars, both fasting and after food sugars, increase in values. If it is left untreated and uncontrolled, this can cause trouble during pregnancy in the form of a big baby, a lot of water around the baby, and it can cause other problems like growth, or alternatively, it can cause growth restriction. So we have to look for sugar values throughout pregnancy frequently, as frequent as every month, both fasting and postprandial values. So in case we find that the sugar levels are high, borderline increase in sugar levels can be controlled by diet and exercise alone. However, as the pregnancy advances, there can be a difficulty in controlling these sugar values, so the patient may require insulin injections. We cannot give diabetic tablets during pregnancy because that crosses the placenta and affects the baby's sugar levels. Whereas insulin, being a large molecule, we can easily administer insulin. Of course, it is not done just by the gynecologist or obstetrician. It is a multidisciplinary team. The patient requires physician and diabetologist guidance and dietitian's guidance regarding the nutrition of pregnancy, during pregnancy. Another common medical problem that we encounter during pregnancy is increase in blood pressure. Again, a woman who has been normotensive, normal BP prior to pregnancy may develop high blood pressure, especially after the 5th month of pregnancy. This once again is due to the challenges posed on the cardiovascular system, that is the blood and the heart system of the pregnant woman, and the hormonal changes and the increased blood volume and the pressure of the uterus on the arterial blood on the arteries. So this causes sometimes the increase in blood pressure in the form of pregnancy-induced hypertension or gestational hypertension. This again causes other problems on the baby. It can prevent proper blood flow to the placenta and thereby to the baby. Uncontrolled blood pressure in the mother can cause intrauterine growth restriction. It can cause detachment of the placenta. It can cause premature labor. So all these complications have to be prevented by early detection of blood pressure, high blood pressure, and treatment of high blood pressure in the form of antihypertensive tablets. Of course, a physician also will be involved in the care of such gestational hypertension patients. And in rare conditions, if we do not control the hypertension, patient can land up with preeclampsia, which is a condition where patient loses protein in the urine. And very rarely there can be a life-threatening, dangerous condition called eclampsia. If we don't control the blood pressure, a pregnant woman may throw fits, that is seizures, in which condition she might end up having a abruptio placenta and intrauterine death of the baby. So we have to be very careful while monitoring a pregnant woman, and always in every visit we check for the blood pressure monitoring. Another very common medical disorder that we encounter, especially in Indian women, because of the type of diet, the vegetarian diet that we have, and the poor nutrition of many women, especially those belonging to the lower socioeconomic status, is anemia. Especially it is nutritional anemia, that is iron deficiency anemia. Patients with any hemoglobin value less than 11.5 grams are deemed anemic. And the anemia can be classified as mild, moderate, and severe. Mild anemia is anything below above 10 grams is mild anemia. 8 to 10 will be moderate anemia, and severe anemia is below 7.5 grams. And below 4 grams of hemoglobin would be branded as severe anemia, which can lead to cardiac failure. So how does anemia affect pregnancy? The embryo, the growing embryo and the baby requires about 6 grams of hemoglobin for itself, for its blood volume expansion. And all this comes from the mother's blood. It is a maternal compartment that has to provide the fetal embryo compartment. So when the mother herself starts the pregnancy with very less hemoglobin, then the baby takes whatever it needs from the mother's blood and the bone marrow, and mother becomes progressively anemic. That is why we supplement first and foremost in the preconceptional period or in early pregnancy itself. If we find the mother to be anemic, we have to treat her first for the anemia, and then she has to embark on a pregnancy. But in many situations, this is not so. Women come to us for the first time during pregnancy, and we detect anemia in pregnancy. So in that case, we have to start iron supplements. For preventing anemia, 1 tablet a day of 60 milligrams of elemental iron, any tablet that contains 60 milligrams of elemental iron for prevention of anemia is fine. But when a woman is anemic, she requires 2 such tablets. So 60-60 will add up to 120 milligrams of iron in 2 divided doses, morning and evening. In that case, she has to take twice a day for the entire pregnancy, starting from 12th, 13th week of pregnancy. Because the first 3 months, because of the nausea and vomiting of pregnancy, we don't start iron. Iron is a metal. It is very good at improving anemia, but at the same time, it can cause distressing side effects like, as I mentioned before, heartburn, vomiting sensation, and constipation, black colored motion, lack of appetite in the woman. So sometimes iron can be distressing and the woman discontinues iron tablets. So for treatment of anemia, we give twice a day iron tablets. And also an iron-rich diet is encouraged. On the vegetarian side, we have green leafy vegetables. All green leafy vegetables are good for boosting iron, and especially fig and dates are rich in iron, in addition to all the other dried fruits. Also fruits such as apple and pomegranate, and in non-vegetarian food, red meat, goat meat or beef if the woman takes beef, then liver and bone marrow, all these are rich in boosting the iron. How much ever iron we give the patient, her capacity, any human's capacity to absorb iron is only 6 to 10%. So remember, how much ever you give iron as tablet form, oral form, because of the other digestive factors, only 10% maximum in a pregnant woman, only 10% of iron is absorbed. So if she is severely anemic, she might, in spite of giving iron tablets, and in spite of, on one side the baby keeping on taking iron for its own blood volume expansion, the woman may remain anemic, and at the time of childbirth she is going to have bleeding. So even blood loss of 500 ml, which is considered normal in a normal vaginal delivery, and 1 liter of blood loss, which is considered normal in a cesarean delivery, it is even such a small blood loss, such a normal blood loss might not be okay for this woman who is already anemic. She might not tolerate this blood loss. That is why we always try to boost the hemoglobin throughout pregnancy, not only just for the baby's compartment, but also the mother should be in the normal hemoglobin side so that she can tolerate the blood loss of pregnancy very well. And if the hemoglobin is very less and we have a short time to delivery, let us say just 3 more months or 2 more months, we can boost the woman's iron and hemoglobin by giving iron injections, IV iron injections. It is not like olden days where iron injections used to cause severe reactions, in fact very dangerous reactions. But nowadays IV iron injections are very good, and we use them very often in the clinical setup in a nursing home. And if the woman is very anemic and the time to delivery is very short, or she is in labor and she is about to deliver, we can always give blood transfusions as the last resort. Another very common complaint that we come across, the patients tell us, is that during pregnancy, the woman is unable to control her bladder. That is, she has small leaks of urine, especially in the later months of pregnancy because of the pressure effects. She can leak urine, especially while sneezing, coughing or laughing, or change of posture. This occurs in multigravidas, that is, women who have previously delivered normally. Because of the laxity of the pelvic floor, they lose the good control of their bladder, the perineal muscles and bladder control. So reassurance, first and foremost reassurance, because this condition will improve after delivery. So we reassure the patient, also screen for urinary tract infections. Another complaint or another feature that we see in a pregnant woman are enlarged veins in the legs. This is known as varicose veins. Because again, due to the hormone effects, the relaxing effect of progesterone hormone on the blood vessels, especially the capillaries and the smaller blood vessels, and the pressure effect of the enlarging gravid uterus sitting inside the pelvis, there is a stasis of blood in the lower extremities, that is in the legs. As a result, the veins become engorged and enlarged, and the varicose veins may start appearing as bluish discoloration at the back of the thighs or the calf region, back of the calf region. Again, this will get relieved after delivery, and during pregnancy also we ask them to move about frequently, wear stockings or a crepe bandage, to roll the crepe bandage over their calf muscles and legs up to the lower thigh, and after delivery it is going to resolve spontaneously. Another very common complaint is backache and pelvic pain in the pregnant woman, especially in the later half of pregnancy. Again, this is due to the hormonal effect. Progesterone per se relaxes all the joints in the body, especially the pelvic girdle, that is the pubic joint, the sacroiliac joints and the hip joints. All the muscles and the ligaments in this area are relaxed. So the woman may develop a waddling gait, and also she develops on the spine, she develops a temporary lordosis. If you look at a pregnant woman in late stages of pregnancy, she walks with a lumbar lordosis. That is because of the stretching of the abdominal muscles forward by the enlarging uterus, and because of that she develops pain in the pelvic area, back pain, and soreness in the pelvic muscles. Again, reassurance, patience and patient caring by her attenders, a little bit of ointments, and if the pain is very severe, mild painkillers which are safe during pregnancy like paracetamol. We just give a reassurance. And my favorite quote whenever a patient comes with all these aches and pains is, the treatment is only delivery. So let us be patient and wait till delivery, and all these aches and pains will disappear. Hemorrhoids or piles, as it is commonly known, is a common complaint during pregnancy. Again, this is due to the enlarging gravid uterus, pregnant uterus sitting in the rectal area, pressing upon the motion passage. It causes engorgement and enlargement of the veins in the rectum and the anus. And again, constipation can aggravate this condition. Constipation, which is the passage of hard stools, can cause the veins to tear open at times and cause bleeding during pregnancy from the anus. So we again reassure the patient and always use laxatives, that is the smoothing agents for easy passage of motion, like loose suspension or other syrups at bedtime the previous night, so that the woman passes motion very freely in the mornings without traumatizing the engorged veins in the anus. And again, we reassure the patient that this is a condition which will disappear after delivery and she will have a resolution of the piles. So friends, we had a discussion on the common complaints, common problems that afflict a pregnant woman during all the 3 trimesters of pregnancy, and also the common medical problems that we as obstetricians encounter in pregnancy. So hope this helps in clearing a few of your doubts. Have a happy pregnancy and a safe delivery.